So the patient chosen for this educational intervention was a healthy 65-year-old female that presented to the clinic for her annual wellness exam. I'd like to state she was newly 65 and had not received the pneumococcal vaccination at this time. After discussing with the patient, we decided a PowerPoint presentation and a pre-test, post-test would be useful in educating the patient. So prior to this PowerPoint presentation, she filled out a pre-test and we went along with the PowerPoint. We started off with going over what Streptococcus pneumoniae is. It can present as pneumonia, meningitis, which is a very bad infection of your brain, or even bacteria in your blood, which we call bacteremia or sepsis. And this vaccination can help prevent some of these complications. It protects against several strains of the Streptococcus pneumoniae. So why is it important? It's not just giving you another needle to the arm. It is effective. They're saying that over 150,000 individuals every year, just in America, are hospitalized from Streptococcus pneumoniae complications. And they're saying the meningitis and the bacteremia portion of it causes over 3,500 deaths per year in America. And this can be prevented from simply just receiving the vaccination. So some of the questions we ask prior to administering this vaccination is your age. At this time you're 65, and it's recommended for you to get this vaccination, but it's also important to note whether she's received this vaccination in the past or not. There are certain indications for younger individuals that are immunocompromised to receive these vaccinations prior to turning 65. In this case, however, the patient is 65 and has no recollection of ever receiving the pneumonia vaccination before today. So some of the guidelines in regards to the vaccinations have changed. Prior to November of 2019, Up to Date, which is a physician-led website that's continuously updated, and the Center for Disease Control and Prevention stated that individuals should receive both strains of the vaccine. So an individual would come into the clinic that had newly turned 65. At that visit, they'd talk about it, and the patient would receive the PCV13, which is the first vaccination, and then 6 to 12 months later, they come back and they receive the PPSV23 version of it, assuming there were no adverse reactions. However, these guidelines have now changed and state that individuals that are healthy, 65 and older, that are not immunocompromised or don't have cochlear implants, should only receive the PPSV23 vaccine. So instead of waiting a year after the first one, they can receive this one in the clinic immediately. They're saying basically that the information on the PCV13 shows that there's been a higher compliance rate in younger children that are supposed to receive this vaccine, so there's less incidence and strains of this causing illness in the elderly population or the older population. So the do's and don'ts. Some of the things we want you to consider, do is consider the vaccine. It's for your health. It's one of those prevention strategies we take as you age to keep you healthy and performing all of your activities of daily living independently at this time. But if you have any questions, please feel free to ask them. Some of the don'ts that we want you to understand is that you cannot receive both of these vaccines on the same day. So you are not able to receive the PCV13 and the PPSV23 both today. So one of the main things that you may be concerned with are the side effects of this medication. The side effects are very mild. Most people complain of mild fatigue, tiredness, weakness, or some muscle aches. Nothing that can't be treated with some over-the-counter Tylenol or ibuprofen before receiving this injection, if not contraindicated. However, in some instances, there has been some serious side effects, such as anaphylaxis, which is an allergic reaction to the med, which has caused trouble breathing, hives, difficulty swallowing, and swelling of the face and throat. We're going to watch you after we administer the vaccine for several minutes to make sure you don't experience this. However, we're going to give you a sheet as well that is classified as a vaccine and then information sheet once you leave that will have all this information on it. So if you do start to receive any or feel any of these side effects, to call 911 immediately. However, they're very rare, and I don't think you being healthy will experience any of this. So to hit on some of the high points though, as I said, the PCV13 is not recommended for all individuals 65 years of age and older now, only for those immune compromised. In your state of health, I think it would be okay for you just to receive the PPSV23 at this time. However, if you have any further questions on this vaccination, we can talk about it in depth further. And of course, I'd like to answer any questions that you have that we didn't cover in the presentation. At this time, we'd ask her if she had any questions, and then kind of hit on the high points before she takes the post-test. That at her age, she is at an increased risk for experiencing Streptococcus pneumoniae. One way to prevent this is through receiving this vaccination. It's a low risk, as we said, but you cannot receive both strands of the vaccination on the same day. With the guidelines changing and the level of evidence being a level 1, we think that it's safe for her to receive the PPSV23 today. And lastly, I've attached the VIS, which is the vaccine information statement that is provided to the patient once she receives the vaccine, or prior to if she would like to come back for another scheduled visit, which explains to her why, what it can prevent, what it actually is, and the 23 types of bacteria that this vaccine can prevent, and other reactions that you might occur that we kind of discussed, as well as the serious side effects which we talked about: the hives, the swelling of the face, difficulty breathing, heart beating out of her chest, or dizziness. To not ignore those symptoms, call 911 and seek help immediately. And provided on the VIS is website information and a number to call for more information on this. So after this, we take any questions and then get her to, of course, take the post-test. And that's it.